News now, I'm Riza Diaz. The Health Department confirms that a new COVID-19 variant known as P3 emerged in the Philippines. This after it announced also today that the P1 or Brazilian variant is now in the country. To help shed light on these developments, joining us on the line this afternoon is Dr. Eva de la Paz, Executive Director of the UP National Institutes of Health. Doc, good afternoon.
Good afternoon, Riza.
Doc Eva,
And good afternoon sa lahat ng tagapakinig. Thank you.
magandang hapon po. Doc, the P1 or Brazilian variant and the P3, which is the variant first detected here in the Philippines, are both under the same B1128 lineage. Ano po bang ibig sabihin nito?
Opo. Ano po kasi ang lineage, ang tawag po doon ay para siyang angkan, no? Angkan ng mga virus. Okay? So, may ang angkan ng mga virus, meron tayong yan itong mga nakita sa Brazil, no, na variants. Ang pinaka-common nga sa atin is the Hong Kong lineage, no? But then ang variant, para po siyang nag-branch out of that lineage. Ang nangyari, nag-accumulate siya ng maraming different type of mutations or combinations of mutations that provided a new it's a new form of the virus, no? And it's the mutations that it has accumulated that makes it quite unique. Kaya tawag sa kanya ay variant na. At ang pinaka-importante ay itong variant of concern. Sa ngayon po talaga ang variants of concern, I'm sorry, Ma'am Liza, ang variants of concern na ating pong we know about are the B.1.7. Yun po yung unang alam ay tinatawag na UK. Meron tayong B.351, yung South Africa, at saka yung P.1, yun yung Brazil. So, yun yung mga variants of concern. Ang nakita po sa atin, yung may signature mutations ay P.3.
Doc Eva, what do we know so far about these variants? How are they different from the other variants of concern, such as those from the UK and South Africa?
What we know, the most important ones about this P.3 variant is that it also contains the N501 mutation at saka yung E484K mutation and another form of mutation that has been found in other variants, no? Yung kung tawagin naman ay yung P681H type of mutation. So the variants have accumulated different types of mutation. And if you see mutations or combinations of mutation, para siyang nagbibigay ng kung tawagin a unique signature of that particular variant. So, ang difference niya is the different type of mutations that are part of that signature mutation. But presumably the concern is because it does have the N501 at saka yung E484K mutation, plus the P681H na sinabi ko, which are presumed to be involved in infectivity. Mm-hmm. Diba nakaka-increase ng transmissibility, tapos yung N501Y, yung E484K mutation naman, nakita na parang it can evade the host immune response. So kaya concerning yung mga variants of concern na mga minention ko kanina are because they have these mutations that can affect the way the virus is transmitted and the way the virus can evade immune response.
Doc, with that being said, how will the P3 or the variant that's first reported in the Philippines affect our pandemic response?
Very good question. It does. The response remains the same, no? And right now, as we see the surge of cases, what we want to happen is that all of us are really mindful about following minimum public health standards because they are still the ones that are important in what's this in making sure that we are protected from the virus. I mean, of course, you've heard about the PDITR strategies of the government, right? Yung prevent, detect, isolate, treat, and then reintegrate. This still proved to be very important measures for containing the virus. The problem with the virus is that this is part of its life. Part of the virus life is to mutate because it would like to be. It's part of their evolutionary their advantage, no? That they will mutate to be able to be better at being a virus. So it's something that we cannot prevent the virus from doing that because that's part of its life. So how do we respond to that? What we need to do is to bring down our cases because every infected person or is a chance for the virus to mutate itself. So the more cases we have, the more chances the virus has to mutate. And so if we bring down the cases, then that in itself is a way of lowering down the chances that the virus will mutate and come up with this new variant of concern.
Doc, the virus is mutating, there's different variants, and at the same time, the number of infections are increasing, but the limited supply of vaccines is an issue. So how can we keep pace with the transmission of these variants?
Mm. Again, that's a very good question because what we'd like to do, the vaccine is really important. So number one, I think I know that there is still a lack of supply, but our government is really trying its best to get the millions of doses that our country needs to have a significant number of the population to be vaccinated to be able to achieve that herd immunity. You've heard that many times already. However, even if let's say the supplies of the vaccine start coming in, we also see that some people are still resistant in having themselves vaccinated, right? So we really need to boost vaccine confidence so that more people, whatever supply of vaccine the country can have in the next few weeks to months, we have to be able to vaccinate as many people in the population as possible because this will lower our cases. So, but it's just a lowering of cases, which gives the vaccine lesser chance to mutate and become a better virus. And so this can help in the prevention measures. But we are not disregarding the very effective non-pharmaceutical interventions, which are hand washing, mask, shields, physical distancing, plus, of course, avoiding crowded places. And if you do have to go out, you make sure that you're in well-ventilated places.
Well, Doc, for your insights and for your time, maraming salamat po. That was Doc Eva De La Paz, UPNIH Executive Director. Now, the Health Department also reports additional cases of the previously detected COVID-19 variants. Nearly 60 new cases of the B117 or UK variant were recorded, bringing the total to 117. Of the number, 30 are local cases, 18 are returning overseas Filipinos, while the remaining 11 are still being verified. Now, meanwhile, 32 additional cases of the B1351 or South African variant were detected, pushing the total to 90. At least 21 of which are local cases, 1 is an ROF, and 10 are still being verified. A fresh spike of COVID-19 transmissions in Makati City has compelled Mayor Abby Binay to impose localized lockdown. The move covers 2 zones in the city where an uptick in infection was observed. The localized lockdown will begin from 12 midnight of March 13 until 12 midnight of March 16. Residents are not allowed to go out of their houses during the specified time. Designated areas are set for pickup for food deliveries. Binay also pledged to roll out a house-to-house swab test in critical zones. Now, over in Cebu, RT-PCR or swab tests will still be required for travelers. This is despite an IATF resolution on uniform travel protocols across the country. In today's Laging Handa briefing, Bohol Governor Arthur Yap explained that they have to require negative swab results as the IATF order also discouraged quarantining arriving travelers. Yap added that new COVID-19 cases in Bohol show an increase when there's a spike in infections in Metro Manila and Cebu.
Whenever sumisipa yung infection rate sa Cebu at saka sa NCR, doon namin na-detect na sumisipa, nahihila rin kami. So, kaya nga critical para sa amin yung testing.
Meanwhile, here are other stories we're keeping our eyes on. Senator Joel Villanueva says there's no need to jail quarantine violators as doing so will only result in increased infections. Instead of mass incarceration, Villanueva calls for the need for mass vaccination. The chairman of the Senate Labor Committee says we cannot afford to add to the burden of the working class. Senator Sonny Angara compels Health Secretary Francisco Duque III to give an update on the 82 million budget for benefits of healthcare workers. This after staff of the National Kidney and Transplant Institute expressed dismay on the delay of the Bayanihan 2 budget disbursement. Until now, some healthcare workers say they haven't received their allowances. And Senator Lito Lapid files a measure which seeks to waive fees and charges for workers who lost jobs during the pandemic. The fees that will be lifted are those for application and granting of licenses, clearances, and employment certificates.
Months in quarantine. 12 months of battling the coronavirus. 12 months of living in a new normal. This March 14, One News brings together the people who helped shape the way we live in the year of pandemic. How have we managed? What we may have missed? Where are we headed? Some of the country's leading voices in the scientific and business communities face the nation as the Philippines balances public health and economy. Kumusta na ba tayo? A town hall in the time of pandemic. Moderated by Robbie Alampay and Cheryl Cosim. Join us live March 14, Sunday. We are One News.
Now, for more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.